You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. Her practice is in Sonoma, California, and people are traveling great distances to get permanent teeth with dental implants. With us, we have an expert on this topic, Dr. Kimberly Hubenette. Dr. Hubenette, welcome to the program.
Thank you, Randy. Nice to be here today.
Good. Now, before we get into today's topic of dental implants, for people that don't know your practice, I guess you have this type of practice that you do everything right there. So what are the different services you offer?
Yeah, well, we offer everything from a little cavity or filling type of situation all the way up to people that have broken down teeth. They haven't been to the dentist for 7 or 8 years. They want to come in and get a whole smile makeover. And also we have another group of patients that don't have teeth and they have dentures and they want to have something that gets in there and snaps in and snaps out, or a full set of nice new teeth so that they can chew, smile, and eat.
So moving on to dental implants, you know, we talked about at the top of the show, no more dentures. Do you believe that?
Oh, absolutely.
That nobody should be wearing a loose-fitting denture?
Absolutely. There's no reason in this day and age why people should be wearing a loose-fitting denture. There's adhesive that gets stuck to their teeth and their gums, and basically there's acrylic all over the palate. So if somebody has a loose-fitting denture, they're used to having something stuck in their mouth, and they're afraid that it's going to fall out with just a loose-fitting denture. Mm-hmm. And so people are used to putting little adhesive in their mouth to stick it in there.
But are there a lot of people, like let's say where you are, you're in Sonoma, but within 100 miles of your practice, are there a lot of people wearing dentures, like an upper and lower denture?
In Sonoma County alone, there are tens of thousands of people.
Okay, good. So if there are so many people wearing like an upper or lower denture, why aren't they all doing it? Why aren't they coming in to get their teeth locked in with dental implants?
Well, Randy, that's an interesting comment and question. There's a lot of factors. After somebody has had a denture and they don't have any more teeth, they don't come to the dentist very often. They only come maybe for a reline, or if their denture is a little loose, and they don't come in every year.
So maybe they don't know their options?
They don't know their options, that's right. Another reason they don't come in is the fact that they've already had their teeth out. They've had years and years of maybe every so often they'd have to come into the dentist when they had a sensitive tooth, or a root canal, or a broken tooth happened, or they're flared out teeth, or maybe periodontal disease, and they've hurt. So after they had all their teeth taken out, no more pain. So they don't want to feel pain anymore. And so basically that's another reason why they don't come to the dentist.
Is it hard to get those people in? Because the last thing they want to do is see you.
Definitely.
Right? Do you still hear that?
They like you. They say, "Oh, I like you, Dr. Hubenette, but no offense, I hate coming to the dentist. This is the worst place this is the worst place I'd rather be other places, but I love you, but I just don't like the dentist." Another reason why people don't come in is because they think they're too old.
How old can you be to get dental implants?
You can be up to like 100 plus years old if you're healthy.
Okay.
You know, there's a lot. I have my eldest patient that I ever placed a few implants on is 85 years old. So that's young.
Really?
Compared to, the 80 is the new 40.
Okay, all right.
That's what I hear.
So, but why would a 90-year-old, you say they could be up into 100, why would they want to do this?
Well, everybody wants to eat and chew and be confident. And if you can't eat or chew, why are you living? There's no, they want to eat what they want to eat. Patients or people, no matter if you're young or old, the commonality is you want to be able to have confidence in your smile. You want to go out into the world and smile and look your best and be able to eat, chew, and speak. And and it's life-changing. If somebody
Is it really?
Yeah, because...
Like you give somebody their teeth back.
Oh, definitely. If somebody has a loose-fitting denture, they hide behind it. Sometimes you think somebody is like mean or their personality changed or they're grumpy. But honestly, it's probably because if they have a denture, they're hiding behind their teeth. I had a patient that came in and she just did not smile at all. She said, I hadn't smiled for 20 years. And she said,
Really?
What can you do for me? So she came in with 3 sets of dentures. So that's what I know. Well, let's talk about options. She didn't even know that she had the option because somebody told her she didn't have enough bone.
Yeah, but isn't it true, though, that if you've been wearing like a denture for 20 years, not enough bone to do this? Is that true?
No, that is not true. This day and age, there's grafting types of things and new technology that we can help almost anybody create and have some sort of a dental implant. Whether it be mini implants or regular implants, I do both.
Okay, so is it true that people could walk in on the day of the procedure, no teeth, and walk out with teeth?
That's absolutely true.
Is that right?
We plan a little bit ahead, and then in the surgery time, we can get them in and out with a set of teeth.
Now, in your practice, I guess the way dental implants are normally done is you go to one place that does the surgery, you go to another dentist that puts the teeth on top. You do both parts. You have training in both parts?
I do.
Okay.
Randy, you called it putting the teeth on top? Well, basically, that's what it is.
So you do both parts of it?
Correct. 20 years ago, I only used to place the restorative over the implants.
So you would send it out
I
like a surgeon?
I would send it out.
Okay.
And then about 10 years ago, I decided I want to make sure that it's stuck in the right spot so I could plan it properly. Mm-hmm. And so then I started placing the implants. And so then now patients love to be at the same place. They get everything done at the same place. They know the staff. They know, because being in your mouth is very, very personal.
Yeah.
And it's really hard to get to know your doctor and the staff members. And then if they say, oh, you have to go somewhere else to get the surgery, then it's a whole nother ball of wax. Maybe they'll decide not to do it because they're just so nervous about meeting somebody else. We have built the rapport with the patients, and so they actually love to make sure that it's all at the same place.
Good.
They always tell me, oh, you're not going to send me somewhere else, are you? No, now we can do everything in the practice.
All right there. Now, is it true, like only like a few implants, like 4 implants, you can give them a full arch of teeth, 4 or 6 implants, give them a full arch of teeth?
That's right.
They either snap in or they're permanent.
That's right. So there's different options. Of course, if you just have a regular denture, you have the palate, and then you have a lot of acrylic over
on the upper.
Okay. Right. And so if you have 2 implants, then we can snap it in and snap it out. If you get 4 implants, then we're able to take out the palate area. And so I actually had a patient that for 6 months, she hadn't come in. The very day that I placed the implants and put in her denture, she never came back for 6 months. And we had called her and wondered, where are you? She goes, oh, she comes in and she hadn't even taken off her denture.
Because it was locked in there?
It was locked in, and she says, oh, I forgot you told me I was supposed to take it out to clean. Now, I really don't want patients to do that. But it was interesting because before then, she was having a loose denture and it would be flopping out of her mouth. And then when we placed this in, 2 implants, only 2 implants, we stuck it in there and she never came back for 6 months.
I know a couple of denture wearers, right? They never complain. Are you saying that really there's no such thing as a happy denture wearer?
Why would they tell you about it? You're not a dentist.
Okay. Yeah,
right?
Yeah, right, okay.
So, yeah, patients that, don't talk about their denture, well, it's probably because they don't want pain and they're just so used to their denture, they don't want to go back to the dentist. But if they knew their options and
like how good it could be,
then they might want to come back in and basically try us out. Back to your original statement about the life of a denture wearer. Well, let me just tell you about the life of a denture wearer. You know, they've adapted. They don't have pain anymore in their mouth, so they're okay, they think. And basically, you know, sometimes their spouse doesn't even know that they wear a denture because they're afraid of taking it in and out. And so when you go to a restaurant, let's say, and you're a denture wearer, you have to look at the menu to see what it is that you can eat and not be embarrassed if the thing flops in and out. Of course, you know, you try to put adhesive in, and sometimes the adhesive kind of wears out and it kind of flops in and out. So the life of a denture wearer,
like eating meat and things like that, or chicken, is tough for some of them?
Oh, definitely. So sometimes people haven't even eaten like a piece of chicken or a steak or, you know, or even salad because it doesn't fit right.
So when you get a set of teeth that are locked in with dental implants, what could you eat?
You can eat anything. If somebody was interested in eating like steak or fish or something that they've never had in a long time, like popcorn or carrots or...
What about chewy things like pizza?
Oh, definitely. Now you could just chew into something and you could eat like a pizza or... I had somebody that hadn't had a steak for 20 years. He says, I have to really cut it into bits and pieces, so can I have that now? You could even bite into an apple with the good
with the front
fitting.
Part of the teeth?
That is absolutely correct. I've had patients come in and say, oh, I can eat an apple now. And I looked at them like, really?
Now let's talk a little bit about the pain. I guess these people, you're offering sedation? Some sort of oral sedation with the patients?
Yeah, most of the time it's fear. And sometimes patients, you know, they think they can handle it. But I like to make sure that patients are very comfortable. We offer pillows and, you know, sedation and relaxation music, nitrous oxide, sometimes a little sedation medication. And, you know,
So during the procedure, they feel nothing?
During the procedure, most of them feel nothing.
Now what about afterwards?
Afterwards, I had a patient that called me up the next day and says, oh my gosh, Dr. Hubenette, I forgot my appointment.
How's that even possible?
Well, sometimes, Randy, people have an amnesia effect with the sedation, and so they might not even remember that they were there.
So this person got their teeth replaced with dental implants, and they thought they missed their appointment.
That's right, and they called up and they apologized to me and my staff for forgetting their appointment.
What'd you tell them?
I said,
go look in the mirror right now.
Yeah.
What'd you say?
I said, you know, you were here the whole time. You don't remember? He says, no. And I said, go look in the mirror. Oh, you know. And they had been in there talking to us, a very nice conversation, and they even cried in the chair looking at their teeth. So they didn't remember that either.
Now you say, okay, so when it's all done, because this is also like a cosmetic dentistry. Because, you know, we've talked on the phone. You say there's a lot of people that wear dentures, but they hate the appearance, so they don't smile because of it. You say these look real. Do they?
I love to do cosmetic approach with a lot of my patients. And so every case that we do, we look at it through an artist's perspective. And so we design in a way that looks natural to a patient. Not, if somebody wants bright white, that's fine.
All right.
But, you know, we look at the complexion, we just, you know, make sure that it matches the person's mouth and their teeth. I've had patients that say, I don't want to look perfect. I want my teeth to be kind of, you know, off a little bit.
Really?
Hey, I could do that if they wanted to. We interview our patients so that, you know, we talk to them and get to know them and know what they want so that we can make them something that matches their personality. And a lot of times their personality comes out after they've had their new set of dentures. You know, sometimes it stumps me sometimes because some patients, they come very shy, they don't smile, and they're like very timid, it looks like. And then when they get their new set of cosmetic teeth, or, you know, their new denture or their new smile design that I make for them, their personality comes out. It's like, oh my gosh, you made a joke. I can't believe it. This, you know, we talk to our patients and our staff members like, oh wow, did you know, can't believe that this person is the same person as last week. They're not
like their charisma comes
their
back.
charisma comes back. And, you know, I've had a couple patients that they're in their late 60s or so, and their spouse passes away, or, you know, they're looking for a new girlfriend or a mate or so forth, and they tell me, I'm not confident right now because they have broken teeth. How can you help me? Can you know, I give them a few options, and then I've had a couple patients that said, you know, they're totally changed after that.
Yeah, but what about those people that they have bad gums? Like bleeding gums, you know, bad breath, I guess you call it gum disease. Can they do this? Or are their gums too bad to do this?
Most of the people have bad gums, and those are the perfect candidates because we clean up all the understructure and we take out all the infection, and then we let it heal, and that's the perfect candidate for implants.
So you could have bad gums and still get these dental implants?
That's 100% of what most of those patients are like.
Is that right?
That's right. I mean, occasionally they crack a tooth and then you need a single implant, but the ones that have a full set of dentures, they have gum disease, or they had gum disease, or, you know, that's why they're getting a full set. But basically, that is the majority, if not all, of those candidates have bad gums and bad teeth.
Now, what if they've been told elsewhere that those teeth need to be extracted and their only option is dentures? You disagree with that. Elaborate on that.
If we have a patient that doesn't have any teeth, there are so many new ways of fabricating a fixed set of teeth. They do not have to have a denture that comes in and out. There's different options. There's anywhere from the palate, a denture that has a acrylic, right? That's the old traditional way of doing it. And then there's anywhere from 2 to 4 to 8 set implants, and then you can have a full fixed set of teeth that never come in and out. It's all in the options.
Well, that's what it seems like everybody would want, right? Teeth that don't come in and out?
Oh, definitely. Definitely. You can have, you know, people have different options.
Now, for the sake of time, I have to cut in here because I want to know, since we're talking about the options for denture. So in your practice, somebody walks in with a denture, or they've been told all of their teeth have to come out and they need a denture, but in your practice, what are their options when it comes to getting teeth back with dental implants?
So the simplest thing would be to do 2 implants on a lower denture. Those are the things that fall out the most. You know, most of the time the patients come in and it's their lower denture that doesn't fit very well. Upper denture, it'll fit so-so with adhesive, but the lower dentures, we call them floaters. So I can put 2 implants in on the lower, full set of teeth, snap in, snap out. Then a little stronger would be 4 on the bottom and snap in, snap out. So they can eat broccoli, they can eat salad, they can even chew a piece of steak. And if they want something that's permanent, they go like to 6 or 8 implants, and then it never comes out.
And they're, I guess the FDA, they're considered permanent teeth.
The FDA, yes, they're FDA approved.
So like 6 or 8 implants, you get a full arch of teeth that don't come in and out.
You can have a full set of teeth that don't come in and out.
And you just brush them like regular teeth?
You brush it. You have to come to the dentist to get them maintained because they're in your gums.
Just like regular teeth, like every 6 months or something?
People are proud of that.
Really?
It's like it's like a third set of teeth. If they have the kind that just are in there and permanent, they're proud to come back in and get their teeth cleaned after that. It's still you never get, with the implant, one thing is that you never get a cavity again.
So you like, I mean, is this, look, you've been a dentist for more than 25 years. Is that right? Is this the happiest group of patients?
Oh, if I put a set of implants in a patient, they're absolutely happy, because then they don't have to worry about hiding behind their smile. There's patients that one day they're covering their face, and then after the surgery, the very next week, they come in and they're giving us cookies and candy, and they're like, I know, why would anybody give a dentist a candy? We had National Donut Day yesterday, and they brought in, one person brought in a dozen donuts for us because they were so happy. And you know, one thing is true, that when patients come in and they're scared and they don't have the confidence, and you think, you know, they're depressed sometimes. And then when you finish their case, they just jump up and hug me.
Is that right?
Yeah, I had a patient that was crying like crazy, and I thought, oh no, what happened? Well, then she was just so happy that she cried in the chair. And she hugged my dental assistant and my front office person. And, you know, we saw her probably about 3 times after that. And then I never saw her again because she didn't have any problems.
So once they get their teeth back, and do they ever call you like, because I guess if they haven't been able to eat things for a long time, like hard things like, you know, carrots or broccoli or salads or whatever, do they ever call and say, are you sure I could eat this? Or are you sure I could eat that? Do they ever, or tell you food eating stories?
There's a patient that said that she wanted to eat almonds. And she hadn't had an almond in years. And she just loved almonds when she was a teenager. And she had a car accident, so she couldn't have, you know, she had all her teeth removed because of the accident. And for 20 years, she was in a set of dentures. In that case, she had gone to a dentist that said she wasn't a candidate for implants because she lost so much bone. So this patient, she thought that she was not a candidate because somebody had told her after the accident that she lost so much bone that she wasn't a candidate for implants. So she never came in for 20 years. She finally found me because I saw her, you know, we met through a mutual patient, and they introduced us. And she says, oh, I'm going to come in for a consult, and, you know, maybe you can help me with a new set of dentures. She never knew. She never asked about implants. I said, well, why? In the chair, I said, well, you know, have you ever thought about that? She goes, oh, I already know I'm not a candidate. And
so she already thought she couldn't get dental implants.
She already thought that. So with this day and age, I explained to her that we can graft, we can add bone back, and then she would be a great candidate. So long story short, we were actually able to get her a fixed set of teeth. And she was so happy. She was eating almonds. She called me and said, and this one,
good.
This patient, you know, I practiced in San Diego for a long time. When I moved up to Northern California, she comes every 5 years to see me up there. She doesn't let anybody else touch her teeth. If she has a problem, she'll come up to me and say, oh, you know, I tell her you should still get somebody to come, you know, to go get your implants cleaned every once in a while, but she'll come every 3 years to come see me.
We are short on time. I mean, we're out of time, but you say it's life-changing.
Yes, it is. Remember that patient that I told you that had 3 sets of dentures when she came in? Well, when she left, after I placed the four implants on top and bottom,
Now, when you say 4 implants top and bottom, you're talking about putting a full set of teeth that are attached to those 4 implants.
Yeah. Attached upper and attached lower, so you snap in and snap out. She absolutely was so excited that she could eat almonds again. She didn't like to go out to dinner with her husband because she was always afraid that they would fall out. Well, she actually sent me a very nice present. She came back in and she asked my staff, what does Dr. Hubenette want for Christmas? What could I absolutely get her? And she didn't have money, but she was just so appreciative that I finally, she found somebody that finally helped her get her third set of teeth back, right? So she has this drawer of 3 sets of dentures, and now the 4th denture, or the 4th set of teeth that I made her, stays in.
Is she going to throw away those other 3 dentures?
She stepped on them.
Really?
She did. She says, oh, in front of you, here you go. She came in and she goes, watch this. She stepped on her first set of dentures in front of us, and we're like looking at her going, oh my goodness.
That's nice though. Okay, so you're going to wipe out dentures? No more dentures in Sonoma?
No more dentures in Sonoma.
Now, as we said at the beginning of the show, in San Francisco, in Sonoma, in that whole area, tens of thousands of people wearing an upper lower denture. If they all knew how good it was, I guess you couldn't even handle the business. You couldn't even handle these patients.
There's enough business for everybody out there, for every dentist out there. If even half the patients came in that had a loose fitting denture or partial.
It'd be very busy. Final message to somebody watching this. Maybe their teeth are really, really bad, or they're already wearing a denture, but they're afraid. Maybe afraid of pain, afraid of cost, because insurance doesn't cover this. We should also mention that. Medicare doesn't cover this, but you'll work with them. You say you have financing, things like that. But what do you say to the person that just for whatever reason they're scared?
I'll tell them this. Look, it's going to change your life if you just have something that that's going to stay in your mouth. It's life-changing. It's priceless. It's absolutely something that they have to trust us too.
Yeah. So come in for a free consultation. Is it a free consultation?
Come in for a free consultation.
So, and how soon will you be able to tell them whether or not they could do it?
If you come in for a consultation, we can tell you that day if you're a candidate.
Okay, good. I want to thank you for coming on the show. And interesting topic. They could go to your website, and you see all the consults. They get to see you?
That's right. They get to see me.
Okay, good. Thanks again for coming on the program. You're watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.